Hello, family. Good morning. It's morning here, a beautiful morning in Kaduna State. Don't mind my phone there. So, I just woke up from sleep. Don't mind me. So, I just want to share with you, God's truth. God's truth. The main reason why we lose parvoviral enteritis cases in the veterinary clinics in Nigeria here. The main reason why your dog dies, the reasons why your dog dies when you take it to the veterinary clinic and is treated for parvoviral enteritis. Now, the main reason is, I'll say negligence. Sure. Negligence is the number one reason why your dog dies of parvoviral enteritis. If you look at the literature, you have 96% chances of survival if you administer intensive care. What intensive care is 24-hour surveillance and care and support. But what most veterinary clinics in Nigeria will do is that by 6 o'clock they have closed, 7 o'clock they have closed, they have gone home. Then they resume by 8 o'clock. Between 7 or 8 p.m. that they close, that dog is vomiting, purging till 8 o'clock. That's a lot of loss of fluid. And by the time you come by 8 o'clock, all the blood vessels would have collapsed. So it would be difficult for you to find the vein again, and the dog will be in shock. And that's why the dog dies. All the time I treated parvovirus, like 90% of the causes of death was times where the dog was too dehydrated, or I left the dog for a long time. I left the dog, but I don't do that anymore anyway. But before, I used to do that. I can go and come back, after 6 hours or something. All the time I lost a parvo patient, in my mind, I know that I didn't do everything I was supposed to. It's just one case. Okay, even that one, I still blame myself. I know I did not do I don't want to go into details, but I know I didn't do all that I was supposed to do. If you cannot do it, you have to employ somebody else or get another person to help you. In vet schools, 500 level, we're divided into 5 groups, 5 team members in a team. We take turns. There's a flunky, there's a surgeon, there's assistant surgeon, there's anesthetists, and then we take turns in the night to take care of our patient throughout the night. In the morning, you do shifts. That's how it is in a standard human clinic. You take turns taking care of your patient. You see one breeder or one other vet trying to take care of 8 parvo puppies. One person cannot handle parvo, you must lose one. Highest, one doctor can handle 2 dogs on parvo if you want to make sure that they survive. If you try to handle more than 2 dogs, you run into trouble. You'll be doing 50-50 chances. If you want to ensure 100% survival rate, now that 5% that might not make it, maybe they have some kind of congenital problems or some kind of complication. But if it's just plain parvo, somebody just have normal parvo, that dog will survive with intensive care. The only dogs that will not survive are those ones that have some kind of complications like intussusception, volvulus, or some kind of twisting of the intestine. And even with that if you are very dedicated and committed that the dog will not die, you will detect it quickly, do surgery, open up and correct the volvulus, correct whatever defect it is, and fix it. That dog will survive if it's parvo. You understand? So it all depends on dedication and commitment to the job. So I don't like hearing parvo is 50-50 case, the dog will survive. No. Tell the client, this is how much it will cost to do this thing. This is the bill. Can you afford this? You cannot afford it, okay. Then you can tell him 50-50 chance. You just try your luck. If the dog survive, fine. The dog will not survive. But parvovirus is not 50-50. Just support the dog 24 hours for like 4-5 days straight, the dog will recover. So there's my take. Why parvo dogs, parvovirus enteritis dogs, or parvo infected dogs don't make it very well in our veterinary clinics. Thank you.